So we screen for 5 cancers right now. That's it. Gallery is a multi-cancer early detection test. It's the first test that is capable of detecting a shared cancer signal across more than 50 different cancer types. And it predicts where in the body that cancer signal is coming from. And it does this with a simple blood draw, which can be completed from just about anywhere in the US through employer-sponsored events on site, through an employee's home and mobile phlebotomy units, for example.
So we work with home care agencies, skilled nursing facilities, family members, and payers, and we connect with the caregivers. They report back the care they're providing, and they earn incentives for providing quality outcomes and care to the workforce. So we believe that COVID actually, I always say it took a pandemic for people to recognize the power and importance of the home care delivery system and the workforce that's providing care in the home, especially family members.
What we're doing is we're bringing a fundamentally aligned model to this space, leveraging both Judy and our care model to ensure that patients and employees are really at the center of care. So how do we do this? Several ways. We ensure that there is no pricing disparities at the point of sale when the employee or the patient standing there at the pharmacy through Judy. We integrate with multiple point solutions to remove roadblocks for employees, ensuring a cohesive experience. And we also have clinicians at the center of our model. Judy allows us to do that.
We provide a patented screening kit that arrives to an employee's home where they pair our kit with a mobile device that gives them access to key health indicators, gives them instant cholesterol, glucose level readings, their blood pressure, all in less than 30 minutes.
Employers are looking at people specifically. They're not looking at their employees like a thing. They're looking at their employees as people, and those people have very specific needs, both collectively and individually. And instead of taking our product and saying, hey, maybe this will work, see what happens, we actually, at scale, can work with employers to address very specific population health needs that they have at their company, or as we do across the VA from San Diego to Boston. We're looking for outcomes that are of interest for employers, and we drive those outcomes through our platform.
What is unique about us and how we're positioned is that we provide the only integrated solution that addresses every key healthcare decision an employer will face, from being hired through retiring. And we've seen that in the pandemic and post-pandemic era. It's really important to sort of drive value at the employee level, which ultimately derives value at the employer level. And we offer a really sort of comprehensive approach to well-being in the market with a deep portfolio of products and services. And we work in harmony to create that sort of concept of healthy minds, healthy bodies, healthy wallets, and healthy lives.
To us, the directive is, if the employee has got a medical-only claim, keep it medical-only so that there is no lost time. If it goes into an indemnity claim, which is lost time and therefore 67% of payroll, then get them back to work quicker, faster. For example, if it is a knee or a knee replacement or an ACL, MCL, we've been known to return to work, workers to return to work 25 days earlier. Each day matters.
What we do at Yumlish is we are scaling nutrition education and exercise competence in a way that is accessible and engaging in underserved communities. So we combine nutrition, exercise content, really think of it as YouTube for evidence-based information, combine that with tech-enabled workflows and one-on-one guidance from a nutrition expert.
Carum as a solution has been validated to have real meaningful savings. The RAND Corporation ran an independent peer-reviewed study that showed 30% surgery avoidance, 80% reduction in readmissions, and 45% unit cost savings. And so as employers are looking for more tangible and immediate savings rather than kind of theoretical or soft savings, we think that makes the difference in this new era.
what we have with our company is the ability to take the very, very, very high level of compassionate, effective, and cost-effective care that we've perfected over decades at Weill Cornell Medicine, and we can scale it. And we're focused now on the employer space. With the pandemic, we really saw that at our weight center at Cornell, where we went from 100% in person to 100% virtual overnight, we were able to get just, the same outcomes or even better outcomes, and patients were so much happier doing everything with telemedicine.
What you provide to employers and their employees is a tool for employees to collect, to use their data, their diet data, their family history, their genetics data, their sleep data, and more other useful data to predict the best we can the chronic conditions they are the most at risk at, and provide recommendation for them to maintain a healthy and productive life.
At OSAR, we're an evidence-based solution supporting and transforming the way that care is provided for people that are living with cancer, as well as their caregivers. So the way that we do that, it's an app-driven program that's supported through a 12-week program with both our coaches and our on-staff oncologists to do symptom tracking and management, focus on exercise and metabolic health, as well as sleeping patterns and overall mindfulness. And with this, we're seeing really good outcomes in all those areas. We have great outcomes as it pertains to return to work and overall productivity, ultimately driving down claims costs with about a 7-to-1 return on investment.